Good afternoon and welcome to our Facebook Live session. My name is Katie Mitten and I'm the lead colorectal CNS for the colorectal CNS team at Gloucestershire Hospital. So we work across 2 hospital sites. As you know, May brought Bowel Cancer Awareness Month, and in conjunction with that and some other events that we did to raise awareness, we thought we would put on this session for you today just to enable you to have a brief introduction into the signs and symptoms and a bit more awareness of bowel cancer. So I've got my colleague Carolyn Cummins here with me today, and she's going to talk to you a little bit more about our team and what we do.
Thanks, Kate. As Kate said, thanks for joining our session today. My name is Carolyn. I'm one of the colorectal nurse specialists within the team. So I thought we'd give a brief introduction of what our role involves so that you've got some understanding of that. We are a team of 7 specialist nurses for bowel cancer. We work within the wider team across Gloucestershire hospitals. We work alongside our 8 colorectal surgeon consultants and the wider multidisciplinary team. So that can be people like oncologists, gastroenterologists, etc. And we all are always able to liaise with primary care as well, so your GPs, etc. One of our roles is to make sure that from the point of diagnosis, or whether there is a suspected bowel cancer, you have access to our service so that we can provide a single point of contact between home and hospital for yourselves, for your family and carers, so that you are informed all the way along as you go through diagnosis. We can offer a range of support and guidance and information right at this at the start of this very difficult time. We can offer very individualised information as well, so that if you've got something that you'd really like to discuss with us, then you can do that in confidence, knowing that everything is confidential at that time. We will also be responsible for coordinating your care and the investigations and making sure that you receive results in a timely fashion. So we thought we might want to start off with some background about colorectal cancer, just to give you some stats. There's approximately 42,900 cases of colorectal cancer diagnosed in the UK per year. It's the 4th most common cancer in the UK. Cases are higher in the elderly population, but in actual fact we are seeing cases diagnosed in younger age groups, and I suspect we'll see stats relating to that in the future. Most bowel cancers arise from polyps, and these are small outgrowths from the bowel wall, and then over many years they go through some changes and eventually can turn into a bowel cancer. Some bowel cancers can be cured with surgery. So many people ask us, what are the risks of developing bowel cancer? And there are certain risk factors that we can address, and these are age is one of the most common factors. Family history, so some people will be more prone to developing bowel cancers if there's a strong genetic link. Lifestyle, and we will go into more about this in detail later on. And other medical conditions, so for example things like Crohn's disease and ulcerative colitis, if you've been diagnosed with those for 10 years or more. Common signs and symptoms of bowel cancer, and this is the message that we would really like to be able to get across to you. So there's been a lot of media interest in bowel cancer recently, so we wanted to reinforce the most common signs and symptoms that you should be aware of. Symptoms can include any change in your bowel function, but predominantly if you are experiencing looser and more frequent stools, but some people, constipation, something different from what you would normally experience, over a period of about 4 to 5 weeks, then you should seek medical attention. If you notice any blood in or around your stools, and this can be bright red and it can be dark blood, so either or, again, you should report this. If you have any unintentional weight loss, so if you're starting to drop the weight and you're unsure why, you haven't been doing anything differently, again, that should be reported. If you experience any excessive tiredness, so if you're noticing that actually I'm not sure why, I've been a lot more tired in my general sort of day-to-day activities, and we can do tests to investigate that. If you notice any lumps, bumps, anything abnormal on your tummy, or if you start to get continuous abdominal pain, again, seek medical attention with your GP. It is important to say that these symptoms can be totally unrelated to colorectal cancer. And so, although people are very worried about this, it can turn out to be something totally different, but it should never be ignored and you should always go to your GP.
Thanks, Carolyn. So I think the next thing we felt would be important would be, so what happens if you have signs and symptoms of bowel cancer? What should your next step be? I think we acknowledge that patients feel that discussing their bowel habits, discussing changes in their body can be quite embarrassing. And some of the reasons for patients not accessing their GP is purely down to this, that the anxiety of discussing these things with somebody that they don't know. I think we would say if you have got these symptoms, discuss them with your family if you're able, or a close friend or relative, and be assured that when you see your GP that you will be treated with the utmost dignity and respect, and hopefully you will be reassured by this. So if you do access your GP might feel that it's appropriate for you to be referred to a specialist or specialist team and organise some tests for you. And these might include a simple blood test. So you may, for example, present at your GP with feelings of tiredness, dizziness, just generally not feeling yourself. And this might indicate some particular blood tests to see if you're anemic. And that anemia is when your blood count is low and you feel those symptoms that I've just talked about. So in addition to that, you might have a stool test that will detect blood to see if there's any blood hidden in your stool that you may or may not have been able to notice. And you may also be offered a colonoscopy. So this is a camera test where a tube is inserted into your back passage, and this enables the specialist to actually have a bird's eye view of your bowel to determine if there's any abnormalities that may be a cause for your symptoms. You may also be offered a particular type of CT scan if you are not able or fit enough to have that camera test. I think there has been some anxiety around accessing GPs, but I would like to say that certainly in our experience within our service, patients have had access to GPs and have been referred in a timely way. So to reassure you of this. And I think it's important to say as well, if you are worried about symptoms and you are calling your GP practice, whilst we know that many of these symptoms are not because of cancer, it is okay to say, I am worried that these symptoms might be cancer. So what happens once you've had these treatments? So your case will be discussed, as Carolyn talked about, our multidisciplinary team. So if your GP has referred you to us and you've had tests that have identified that you have a bowel cancer, then all of these investigations are discussed with our specialist team. And then we are able to offer you the best treatment. It's very individualised, and any of these treatments possibly may include surgery, radiotherapy, chemotherapy, or a combination of these things. So just to think about a little bit about what if I don't have symptoms, what is available. So bowel cancer screening, as you may or may not be aware, is it can happen. Patients can be diagnosed with bowel cancer without actually having any of these symptoms, and therefore bowel cancers are picked up during a routine screening test. So currently the National Bowel Cancer Screening Programme invites people between the ages of 60 and 74 years of age every 2 years. Fortunately in Gloucestershire we've been able to extend this to 56-year-olds, And the intention and the vision is that over the next few years that age range will increase, rolling down to 50 years old by 2025. You can opt in after 75 years if you choose to do so. Invites for bowel cancer screening are sent through from a centralised hub, and ours is in Guildford. And if you have not been invited and you are between these age ranges, you can contact them directly, and they will be able to help you. So what happens if you are on the bowel cancer screening programme, you are sent a particular kit called a fit test, which involves testing your stool or your poo. And if you have a positive test, you'll be then offered an appointment with the bowel cancer screening team, who will discuss any ongoing tests off the back of this positive result. And that usually is a colonoscopy, so the camera test that I talked about, or more rarely the special CT scan. To reassure, most findings of cancers are low by comparison, and 40 to 50% of people are diagnosed with benign or non-cancerous polyps. Cancers are generally in about 10%, so about 1 in 10 people who come through with a positive fit test have a diagnosis of bowel cancer. It's really important to say, however, if you are within the screening age group and you are awaiting a screening test, or you know that you might have one due in 6 months, if you have symptoms and any of those that Carolyn's talked about, please do not wait for your screening test to be sent to you. You need to access your GP to discuss these symptoms and have them assessed further. So we talked a little bit about what risk factors for bowel cancer. So Carolyn's going to talk a little bit more now about some of those healthy lifestyle choices that you can make to help.
Yeah. So one of the questions that we get asked quite frequently is, what can I do myself to reduce the risk of developing colorectal cancer, bowel cancer? And we always sort of say it is about being aware and about proactive in your own lifestyle. And if you can do that, then just small changes can help to reduce your risk. One of the most visible sort of things that we can do is about our diet. So it's about eating healthily, and we're not here to preach, we're just here to give you some information and advice. So small changes like including dietary fibre can help, so that you keep your poo moving along the colon, and that will be one of the things that can help. To reduce red meat and processed meats, so you're reducing the animal fat intake. And the literature suggests that you should be taking less than 70 grams per day, which can help. So, a couple of sausages less, a couple of beef burgers a week. Small changes can make the difference. Reducing your alcohol intake. So we know that alcohol can damage cells and stop cells repairing themselves. And so by cutting down or stopping can reduce your risk. The advice is to have no more than 14 units over 3 days or more. So just by cutting down on the odd glass of wine or pint of beer, again, you will be doing your bit to help reduce your risk.
So one of the other lifestyle changes is exercise. We know that bowel cancer is linked to obesity, and there is strong evidence to show that people who exercise and are more physically active have a lower risk of bowel cancer. So our message would be to say, we don't expect you to be running marathons if you don't normally run a marathon, but to just increase your normal level of activity, whatever that might be. Can I walk to the shop rather than take in the car? Could I walk a little bit further than I would normally? So that's the sort of thing that we would encourage, and that's the national advice and guidance. And then smoking. So bowel cancers are linked to around about 7% of bowel cancers in the UK. Generally, good health involves reducing your smoking intake or cutting it out all completely. I think that the message as well would be to say that this not only helps reduce your risk of bowel cancer, but actually if you are diagnosed with a bowel cancer, the fitter and healthier that you are enables you to undergo the treatment that you might well be offered. So the last thing really is to think about what support is out there is if you are diagnosed with bowel cancer. So you have the support of your colorectal CNS team, your key worker team, you have access to a cancer support worker. And obviously there are many support networks out there, so we are very lucky locally to have a very wide and widespread set of support networks. So for example, Maggie's Centre in Cheltenham, Charlie's, the Macmillan Hub here at Gloucester Royal Hospital, Focus at the Oncology Centre, and there are also many websites which you can access, for example, Cancer Research or Bowel Cancer UK. So while we've been talking, I suspect there's been some possible interesting questions, so we would be very happy to answer any questions that come through.
Nothing at the moment.
Nothing at the moment, okay.
I think just leading on from what Kate is also saying about getting support is it's about talking about bowel cancer. So if you can open up that dialogue, it may be a friend, it may be a family member, maybe a colleague at work, but to just voice your concerns if you are developing any symptoms, just to start that process of you being able to talk about it and then accessing the right help. Kate's right in the fact that once you're referred to our service, you have the constant reassurance of being able to access our service for information at all times, so that we can give you the up-to-date information that you require. We say that yes, Google things if you want to, you know, everybody does that, but make sure that you do go on the reputable sites, and we can put some information on those at the end on the Facebook page for you.
So I don't think we've got any questions that have come through, so we'd just like to say thank you for joining us. Hope you find it helpful, and look out for some further Facebook Live events perhaps in the future.
Yeah.
Thanks, Carolyn.
Okay, thanks, Kate. Thank you.